Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. We're taking your calls at 866-870-5752, and you get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with 264 scientific studies. And right now we are speaking with Gavin in Burbank.
Hey, Gavin. I was
Yes,
just
sir.
on the break. I was just answering texts from about 10 patients. Everybody knows that I give out my cell number, and patients always have a lot of questions. And I literally, I'm embarrassed to say I forgot what the last thing was I was talking about. Do you guys remember?
Yeah.
Well, of course, the last thing you were talking about was the PMF, which I was using. And granted, I agree with you. It does relief, but I am looking for something that's a more permanent factor, and I don't want to undergo surgery. That's why I'm interested in stem
Right.
cells.
No, there was something else needed. Do you remember what it was?
No, but I don't. Sorry.
That's okay. I'm not putting down PEMF. You know, if you like it, you should use it. I'm just saying it's not something that is anything like regenerative medicine, where you're going to use your platelets or your stem cells to regrow that cartilage behind that patella, you know, your bone in the front of the knee and that joint. So I think there's a good chance you're going to heal up, Gavin. The number to the office is 800-300-9300 if you want to give a buzz there right now to get more information.
So I can call that today after I'm...
Yeah.
Right
Yeah,
now.
definitely.
Quick question for you, if you don't mind. I
No,
understand that the length of the process is basically determined by the degree of my damage, how many treatments it will take are all determined by that. But my question for you is, once treatment is done, what is the downtime that you recommend for me not to use? Because obviously I have a very active work life and playtime. I can sacrifice the play. I can't sacrifice the work. So I'm curious to know
That's
what's
true.
the downtime.
I'm going to say it like this. Every patient has that question, and the answer is up to the patient. I'll advise, and I haven't examined you yet, so I can't tell you, but you have to live your life. So as an example, I with knee patients, hip patients, foot, toe, ankles, whatever that is, I'm going to tell a person not to go up and down stairs. And they sometimes say, but I have 18 stairs to get to my apartment. And I go, well, then do the 18 stairs. Just do it as infrequently as you can. So in the best of all possible worlds, you know, you would not want to use it at all, you know, in terms of exercising. And, you know, walking around is exercise. Walking stairs is exercise. But you got to live your life and you got to do what you got to do. So there's no hard and fast rule. When I see your knees, I will tell you what I think, and then we negotiate what you like to do. Okay?
Okay.
Thanks for your
Well,
call.
thank you very much for the information.
Yeah, God bless you, Gavin, and there's good hope for you healing up and getting back to being an Olympian downhill skier again.
I will be in touch with you. Thank you very much.
All right. Thank you so much for the call. I appreciate it.
Our number is 866-870-5752 right here in the studio. You can talk directly to Dr. Darrow. Do you want to go to Doug?
I do. Doug, you've got a 7-millimeter herniated disc. Can stem
Yeah,
cells
hi, how are you, sir?
help you? Yeah, do you have pain in your back?
Yeah, I do, and it's not so much pain. It's I wake up in the morning and I'm extremely stiff. I feel like it's extremely inflamed, and I have to go on the inversion table to really get going.
Okay.
I enjoy going to the gym. I lift weights. I was doing jiu-jitsu, but I just can't do it anymore.
Yeah.
And if I go on the inversion table, I can get to the gym and I can do my weight routine and my Stairmaster and all that. But it still kind of wakes me up at night. It's really when I'm laying down for a long time and
Okay.
very uncomfortable.
So is the main issue you just have low back stiffness?
Yeah, I mean, it hurts. It does hurt if I sit too long. It's very stiff and uncomfortable.
All right.
They told me I needed surgery. I tried decompression therapy.
Sure.
That helped very little, I'd say.
Yeah. Okay, so here's good news. The good news is that they told you need surgery and you didn't do it. That's the good news. And the reason I'm saying that is a herniated disc doesn't have to cause any pain. Okay? I don't know. I'm not sure what part of the show you tuned in on, but in the beginning I was talking about people having things like herniated discs or meniscal tears or rotator cuff tears in the shoulder or all these terrible things, labral tears, terrible, 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 right? No, because a lot of people have those and have zero pain. So that herniated disc may have been there for an awful long time before your back started bothering you. And again, like I tell every single person, I need to examine you and touch the area. I can generally tell you in about 2 minutes if it's something that I can help you with or whether you need surgery. I don't remember the last time I ever sent somebody to surgery, although probably half the people that come to see me have been told they need surgery. After treatment, they didn't need surgery anymore because it wasn't a surgical issue. And from what you're telling me, this is not a surgical issue. Okay?
Yeah, they really made a big deal. They said 7 millimeter is huge, and they need to go in there and do a micro incision and cut off the herniated part, basically.
Yeah, I don't agree. Just from what you're telling me, I have to examine you to tell you. Did anybody touch your low back? Did your doctor touch your low back?
You know what? Not really. No.
No. Right. So how the heck does he know what's going on?
That's interesting. Yeah, they did toe, where they do these things with my toe and my reaction. And,
yeah, I know.
But no, I don't ever remember him really getting in there and touching my back.
The first thing I'm going to do if you walk in the door is I'm going to have you lay face down, touch your low back. That's how I'm going to tell what the issue is. Not from an MRI.
Well,
never from an MRI.
Well,
I like people getting MRIs just as a backup because a few times I've found cancer or these weird tumors and things. So I like to get that as a backup. But no, doctors need to use their hands and examine people just like my grandfather did, who was a doctor born in the 1800s. He didn't have an MRI.
Right. Okay, well, yeah, I'd love to see you. And is this something like that can heal, or is it something that I have to?
No, from what you're telling me, I think that using regenerative medicine, cells from your body, platelets or stem cells, can heal it up. And from what you're telling me, you don't seem too bad.
Wow. Okay.
Get that 7 millimeter herniated disc out of your mind right now.
Okay, because there has been times where I can't even walk.
I understand. I'm not saying you're perfect.
Okay.
But from what you're telling me with your activity level, there's not much going on that's terrible. And it is hopefully healable. I'll be able to tell you as soon as I touch it.
Okay, great. I'm excited. Okay, I'd like to see you. Thank you so much for the time.
All right, and the number to the office is 800-300-9300. You can call there now. There's people by the phones. And you can go to the website, which is www.lastemcells.com. That's www.lastemcells.com. And you can watch videos of me injecting the low back and see if it's something you want to do. It's a lot easier to walk in the office, get some injections, and walk out than getting surgery and not knowing what's going to happen.
Right, absolutely. That's a good point. Okay, lastemcells.com. I'd love to get in touch. Thank you so much. And
every page on that website has a spot where you can email me, too.
Okay, wonderful. Okay,
Doug, God bless you. There's good hope ahead.
God bless you as well. Thank you.
Thank you, Doug.
Thank you.
Thanks.
Appreciate your call. 866-870-5752 is our number right here in the studio. Call and speak directly to Dr. Darrow about your pain, especially before you're about to roll into an elective surgery, right?
Yep.
So you want to go to Steve?
You know what my mom used to say?
What?
When something would happen to her, I go, Mom, I got to take you to the hospital. And she'd go, don't take me to the hospital, Mark. And I go, why? She goes, because they'll roll me in the front door and then roll me out the back door. She did not like doctors. Whoa.
Well, she loved you, though.
Oh, she loved me.
Yeah.
She wanted me to be a doctor, but she didn't like going to doctors. And her
Yeah.
father,
No,
and the reason is simple. Her dad was a doctor, and the office was in their house, and they lived in a black ghetto in Chicago. So they had a lot, when she was a little girl, they had a lot of stabbings and gunshots and people screaming in the house. And she got terrified. And to the day she died at 102, she never, ever wanted to go to a doctor. She would fight me to go. One time I had her go to the dentist, and the nurse called up, or hygienist called up, whatever it was, and said, "Dr. Darrow, your mother just punched Dr. Sun in the face. What should I do?" So yeah, she was traumatized. She was really traumatized as a little girl.
Wow.
So anyway, the question for Steve here, thank you for calling in, Steve, is can inflammation in lungs be resolved with stem cells? I'm going to say the answer is yes. It's not something I do. I stick to orthopedics. Please turn off your radio because we're getting the echo back in here. There are guys who do stem cell inhalation in the lungs. I don't know who they are. I have definitely heard of it many times, and I've had patients come to me who have had all kinds of lung diseases healed with stem cells. It's not the work that I do, though, and I don't think the medical board in California would like me very much if I did it, but there are guys who do it. You got to get on the internet and do a search, and you will find them, okay?
Thanks for your call, Steve.
And we're going to go to Jonathan. Let me give out the phone number to the studio again.
Okay.
You can call me and Nita right now at 866-870-5752. You get a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Took me 5 years to write this book, get all the research together for it. I think it's a great book, and people seem to like it. I write it in a very simplistic rather than a medical way. And if you call in right now, I'm going to send you a copy of it. I'll mail it out to you, and for free, totally free. And again, the phone number to call me right now is 866-870-5752. Jonathan, let me read what the call screener said here. Your right knee has degenerative arthritis. Can stem cells help chronic pain? The answer is typically yes, not always. So tell me more about your knee and how long it's bothered you for, and what the MRI shows and what your doctor said.
I had an appointment, or I actually met with an orthopedic doctor, and obviously what they're saying is that I need a knee replacement.
Okay.
I had X-rays, and but the funny thing is that I have no pain. I don't have any pain.
Well, then get the knee replacement, and you may.
So seriously, I don't know.
I'm sorry. This is hysterical, and I'm laughing a little bit, but inside I'm not very happy. I'm just going to be honest with you. This makes me very angry. Why is someone going to give you a major surgery where you could get infected, you could die, you can end up with a terrible thing when you don't have pain? You tell me the answer to that one.
I don't know. I don't take pain pills. I don't take anything like that for that. I mean, I lose my balance a little bit. I'm a golfer. I'm a walker. I'm a cyclist. I'm afraid to cycle anymore because I just don't have that balance. I feel a little bit off balance.
Yeah. How old are you, Jonathan?
I'm 70 years old.
Okay. The balance thing, I would go get checked out. Start with an ear, nose, throat doctor. That's where you start. And then if they don't find anything, they may send you to a balance expert, because that may not be from your knee. As we age, we lose what's called proprioception, which is our ability to know our body part in space. Okay? So it's not uncommon.
Well,
and people have it without...
And I could fight a fish standing up. I could fight a marlin standing up. And but now I find it a little bit awkward. Now I have to depend on the boat gun to kind of keep my balance.
Well, all that's fine. All I'm telling you is this may not be related to your knee. and it's something that you may want to get checked out because there could be something going on that you can heal. It's not what I do. I'm not a balance expert, but there are balance experts. But the knee...
Now right.
The knee is a different story. I mean, if you're having any kind of discomfort with it, that's something that I'd love to look at with you. Okay?
Yeah, I really don't, but it's, like if I'm stepping down stairs, of course, there's a little bit of, like a niche, but not a sharp pain.
Yeah.
I can walk up, but it's not a sharp pain either, but I just don't have the strength that I used to have to be able to walk.
Yeah. Okay. Another thing that happens with aging, Jonathan, is we're not as strong as we used to be. And if you are having some kind of pain in your knee or other joint, we guard that so it doesn't hurt. We keep it from hurting. And the way that looks is that we're weaker. So I'd have to see you. You know, this is sort of complex, and you've got some issues that should be looked at. Okay?
Okay. So I call that 1-800-390-300?
Yeah, 1-800-300-9300. You can talk to my staff there right now, and I'll be glad to see you and give you my 2 cents on what's going on. And I'm certainly not going to send you for knee replacement.
So you can actually inject cells onto you can actually inject something that my cartilage will grow?
Yes. There's no question about that. That's been studied.
I do have a copy of the X-ray. I can either email it to you or take it when I see you.
Well, just bring it in. I mean, emailing me doesn't do any good. I need to see you and then see what's going on. And the X-ray is not going to tell me a whole lot. I need to examine you.
Okay.
I want to see the X-ray, but I got to examine you, and then I'll look at the X-ray.
Okay.
X-rays don't tell the truth all the time. And I'll give you an example. I had a person come in yesterday, a new patient, and this person is a physical trainer, very active guy. He's actually about my size, he's about 6 feet, 165 pounds or so, and a real sports guy. And he's got advanced arthritis in his left hip, okay? And of course, what do they want to do? Give him a prosthesis. Well, I examined him, and he walked around, and he's in good shape. So his X-ray looks bad, but he's good.
Huh.
So I'm not going to treat based on his X-ray. All right?
Well, I did a 100-mile ride. My last 100-mile ride from here to San Diego was last year.
Okay, you're in good shape, man. We can make you better, but stay away from the knife. That's all I can tell you. There's no point.
Stay away from the bike?
The knife.
Oh, the knife. Okay, yeah. Yeah, no, I used to do spinning training at the YMCA.
Yeah.
For like 10 years I did that.
Okay. No, you're in good shape. You're not going to be any problem to get better.
Physically, I don't have a problem. I mean, I'm 70 years old, but I don't feel 70.
No, you don't. You sound like you're 20. Anyway, Jonathan, God bless you. We're going to move on, and I'm going to give out the number to the studio right now to talk to me. I hope you call me. It's 866-870-5752, and I would love to speak to you. If you call in right now, I'm going to send you a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. There's about 250 studies in here about regenerative medicine using platelets and stem cells, and studies showing that surgery is really not a great thing to do for a lot of these things that really don't need surgery. I mean, we've heard about it on the show by several people who've called in who were told they needed surgery and never did it and were healed by this. And I'm the guy that had the surgery before I knew about this, and it turned out terrible. So, and then I healed it using my own cells from my body. So I'm a believer in this. Most of my patients are believers in this. There are a lot of patients I have that didn't heal because they didn't follow my advice. And it wasn't the treatment that failed, they failed. So that's where I'm at with it. Nita, it's time for What Do You Think?
Well, I was just going to share that I also had prolotherapy. So I'm also one of your success stories.
Yeah,
just
you had
reminding you.
Yep, your neck was. Did they tell you needed surgery? By the way, I forget.
Oh, yeah. My chiropractor fired me because he said I needed surgery. Well, because I got the x-rays and the MRI with him. Yeah. Then I went to, I was trying to get a second opinion from another chiropractor. He wouldn't even see me. And then I heard about you. Well,
I'm glad you're okay now. So anyway, are you ready? You're on the pin.
Oh, I was trying to distract you. Yeah, I'm ready.
Nita, you have 2 seconds to answer this question.
All right.
What do you call it when Batman skips church?
Ooh.
Christian Bale.
Oh, wow. I never would
That's
have
pretty
thought
good.
that. That's really
whoever
a good
figured that one out is pretty smart.
Wow, that's a good one.
Okay, one more and then we're done with this.
All right.
What did the elevator say when it sneezed?
Hick up.
That's good. I like that. I think I'm coming down with something. Oh.
Okay, 866-870-5752 is our number.
Save her.
Here in the studio. And check out the website, www.lastemcells.com. That's www.lastemcells.com. And if you can't call and you really want some attention this weekend, you should just call the office directly. People are answering the phones all the time. 800-300-9300. That's 800-300-9300. And you can email Dr. Darrow off of every page on the site. And you can see him performing the treatments on videos. That's very educational and pretty exciting.
Absolutely. I think I've got a great website, too. I work on it every single day.
I know. I check it all the time. It's always different. You're always updating it. You're on top of it. No, that's good. That's really good. Yeah.
I love it. I love communicating with people, educating. I was a teacher at UCLA in the residency program for physical medicine rehabilitation for 20 years. And I love when the student doctors come and they call it shadowing me. They watch me, and I teach them how to do the work that I do.
Okay, we've got Al. We're going to run out of time.
Oh, let's do it. Al, Marc Darrow, Dr. Darrow, how are you? You've got problems with pain in your legs. What's up with that? How long has that been going on?
I'm not sure exactly what it is. I had edema.
You had what?
Edema?
Edema.
Okay. Is it in both legs or one leg?
Both legs. And then
okay.
I have peripheral neuropathy.
Okay.
I lose my balance real bad.
Oh, boy. How old are you, Al?
I'm 81.
Okay. So this isn't what I do for a living, but I'll give you some information about it. Number one, you need to get a blood test that checks all of your vitamins, minerals, amino acids, and antioxidants. We do have it at our office. It's called SpectraCell. And that may tell you if one of these things is low that can cause the nerve damage that you're having. Secondly, you need to go to a cardiologist because edema in the legs is often from the heart not functioning as well as we want it to. And then the fluid that's being pumped back up to the heart doesn't get back there very well. So gravity leaves it in the legs. We call it dependent edema. And that's all I have to tell you right now, Al. And we're ending the show, unfortunately. God bless everybody. Thank you, Al. Thank you, all the callers. Thank you, Nita Valens, for being a great host. Thank you, Suzette. Thank you, Alex. And if you want to watch videos of me doing these procedures of stem cells and platelets, go to www.lastemcells.com or call the office, 800-300-9300. Thank you, everybody.
Thank you, and thank you, Steve. See you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.